Good morning, 1027, 1035, WICY Feel Good Favorites from the 80s and more. It's John Kazar with you, and on Wednesdays around 9:40, we dive inside the community with those at Hyde Medical Center. Matt Jones joining us again. He's the Chief Operating Officer and Senior Vice President with them. Matt, nice to have you back.
Thanks, John. It's good to be back.
Yeah, tell us what's been going on lately.
So a lot has been going on at the hospital just around visitation policy. Has been kind of a big focus of ours. Last week, the governor put out an executive order that allowed hospitals to reopen up visitation within the hospital.
Yeah, and that's huge, and it means a lot for so many people, doesn't it?
Absolutely. Part of the care and when we're caring for patients, a big piece of patients getting better a lot of times is having access to visitors and patient and family members and stuff like that really helps them along in the care process. Sure.
So what are the details of the visitation policy? Can they only stay a certain amount of time? Kind of lay out that for us.
Yeah, so our visitation policy that we developed, it's kind of in accordance, again, with the executive order from the governor. It really includes opening up visitation for our emergency department, our med-surg floor, and also our maternity department. And what we do is we have visiting hours between noon and 2 p.m., and then again from 5 to 7 p.m. to try to catch people that maybe are working during the day but still want to see their loved ones in the hospital. They have that opportunity from 5 to 7 at night. We haven't been able to open up any of the visitation yet for our skilled nursing facility or our long-term care facility at this time. Still, per the Department of Health guidelines, those are still shut down.
Sure. So these are your policies for now. Any idea when they're going to be updated? Does it go along with what the governor is deciding to do?
Yeah, so right now we're meeting what the governor is allowing us to do at this point. They've expanded it to say that we can have up to 4 hours of visitation policy in our hospital at this time. So that's why we wanted to try to separate it out a little bit to try to reach more people that might want to see their loved ones.
Awesome. And so, in the future, I'm not saying immediately next week, but we want to get updates on, the Alice Center positive testing and all that. Is that something we can look forward to?
Yeah, absolutely. We did have a positive test in our Alice Center from a staff member that was there, but I can safely say that that staff member has now tested negative to the COVID. So it definitely was something that the team at our Alice Center put in some things quickly in place and really kept the facility safe.
Yeah, first thought for a lot of people when they hear that is, but again, we're only at one. I think this is the only one right now that's active in the Franklin County area, at least, right?
Yeah, I believe it. There's one active case in Franklin County right now. I think it's something that, as a community, we've done a great job at trying to protect not only the community but ourselves. And as a hospital and long-term care facility, we try to take those things serious as far as taking care of our residents, our patients, our staff members, and everybody in the community.
Yeah, let's keep doing it, Matt, and we'll talk to you in the future. Okay.
All right, appreciate it. Thanks, John.
All right, Matt Jones with us. He is the Chief Operating Officer and Senior Vice President at Hyde Medical Center. We speak with those from there every single Wednesday, 9:40, inside the community. It's 1027 and 1035 WICY.